Hello, everyone. Welcome to our live. Please invite other people to join. Please invite other people to join our live because we have interesting things to talk about today. And also do remember that we have a whole lot of things to give today for the first 20 people that joined us today. So please join our live. We are taking notes. As I'm on this live, we're taking notes of people that are joining us for your data giveaway. Please do well to invite other people to join us. Please, the first 20 people to join and comment on this live, we will be giving them a data giveaway. The first 20 people to join on this live and comment and also share, please. It's not only about commenting. You comment and also share this live. We have something for you. It could be a recharge card. It could be data giveaway. We are sharing it immediately after this live. So please do well to join. We'll be doing it, we'll be giving it out immediately after this live. It could be data giveaway, it could be recharge card giveaway. So once you join, you comment and share so that it will be easy for us to take notes. Okay, please do well to join, join, comment and share. So first and foremost, I want to introduce my name. My name is Nurse Gift. Okay, so we'll be talking about something important today. We'll be talking about something very important today, and I'm going to be. This is just going to be a heart-to-heart discussion. Okay, I'm going to talk about little things that matters. First and foremost, you know that Ijenwa Fertility and Womb Massage Clinic is a clinic that deals with infertility issues, infection, and what have you. So it has come to our notice that most of times men tend to leave everything for the woman. They tend to leave the whole issue on the woman, which is not unfair. Please, I'm talking to the women in the house. I'm also talking to our husbands in the house. Please, it has come to our notice that this infertility issue, we leave it for our women. A whole lot of women are going through a lot because of this infertility issue. A man comes into the house, he now maltreats the woman just because she has not given him a child. It's not supposed to be like that. This cross, you two are carrying it together. It's not only meant for the woman to carry alone. You two are carrying the cross together. And remember, that's that woman you took to the altar that very good day. You promised to take care of her. You promised to go through thick and thin with her. You promised never to leave her. You promised to, you promised for better, for worse. So I think you should stand by with her in any situation, in any problem, and not make that woman feel like she's all alone. Yes, don't make her feel like she's all alone. She goes back to her pillow every night soaking her pillow with tears. No, it's not supposed to be like that, please. I'm talking to the husbands in the house and to our women, please, please, please. It's only God. As in as much as we do give drugs, doctors treat, but God heals, okay? Yes, and we are only pencils in the hand of the Creator. In as much as you're taking medicine, God should be your number one in everything. God should be your number one. All your problems, He's the only one that can give you solution. We do treat, yes, quite all right, but God heals. So in as much as you're getting all those ill treatments from the society, from the family, maybe from your husband's side, they are not treating you well just because you've not given them a child. My dear, hold on to God. God has the final say in everything. God is the one that can change someone's life situation in just a minute. You can see somebody and you say this person is poor. Within a second, within few minutes, you see that person, the person's life changes. God is the person that can do that. No man on earth can change somebody's life, somebody's story like that. It's only God. So in as much as you're getting those treatments from your husband, from the family, from the society, I am telling you now, hold on to God. He will never ever leave you. Please, as you're joining, comment, share so that you will get your giveaway. Please join, comment, and share this live so that you'll be able to get your giveaway, so that it will also be easier for us to take note. Okay, please join our live, comment, and share. So as I was saying, please, no matter the ill treatment you might be getting from your husband, from your society, from your mother-in-law, please hold on to God. He is the Alpha and the Omega. He's the beginning and the end. He's the creator of the whole universe. Even before you entered that marriage, even before you got married, even when you were in your mother's womb, God knew you. God knew you. Even as you're facing that situation, God knows that you're facing that situation. And when He will answer you, my dear, all those years of sorrow, all those years of pain, you will forget them. You're not even those what will be in your heart is just that joy. You will forget all those years of sorrow, all those years of pain. You will totally forget it. Hold on to God. Your husband comes back home, he treats you badly, even maybe he's the person that normally provides food in the house, but because of that issue, now you've not been able to give him a child, he has drastically changed. Maybe he now keeps late night, he comes back home late. My dear, please, 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 please hold on to God. And when you're praying, please be putting that man in your prayers. Please tell God, look at my husband, look at him, look at what you want, I want you to do for him. Change his life, change his heart towards me, God. And you will see God doing that for you. Even as we give you medicine, once you want to take that medicine in the morning, you pray, God, look at me. Look at me. You know my heart desire. Yes, I'm taking treatment in Ijeoma Fertility Clinic. Yes, God, I am trusting you to answer me from this clinic. I am trusting you to hearken to my voice from this clinic. I am trusting you to give me my positive results as I'm taking this medicine. God, is there anything that is not okay in my body system? Is it my reproductive organs? God, please, as I'm taking this medicine, let them be put in order so that I can be able to conceive and bear my own child. Please, do everything. You put God first. In the morning when you're taking your medicine, you pray before taking it. Even at night, you pray. Keep on putting everything in prayers, and you see the hand of God answering your prayers. Okay, so today I want to be talking about health. Yes, I want to be talking about health. And according to WHO, health is defined as the complete state of physical, mental, and social well-being of an individual, not merely the absence of disease or infirmity. Let me repeat myself again. Health is the complete state of physical, mental, social, on spiritual well-being of an individual, not merely the absence of disease or infirmity. You might be sick physically, and you think that because you have malaria, that's the only time you're sick. If you're sick spiritually, if you're sick socially, how do I mean socially? The way you interact with people, your interaction with people. If it is poor, if you don't know how to handle situations, if you don't know how to handle relationships with your fellow human being, my dear, you are sick socially. Yes. It's not only when you're sick physically. You say, because I'm sick physically, I'm sick. Oh, that's not only when you're sick. If you're sick spiritually, if your spiritual life is not in order, if your spiritual life is not in order, my dear, you are sick in that aspect. If you're sick socially, the way you interact with people, your relationship with people is poor, is not good, my dear, you are sick in that aspect. Then physically now, the one we all know, maybe you now go to a hospital, you're being diagnosed of malaria. That one is the physical aspect. So please, health is the complete state. For you to be healthy, you have to be healthy physically, socially, mentally, spiritually. I'm not the one that said that. That's the definition of health according to World Health Organization. I'm not the one that said it. They knew the reason why they said it. It's not only when you're okay physically, that's when you now term yourself that you're healthy. No, that's not only when you tell yourself that you're healthy. They said health is the complete state of physical, mental, social, and spiritual well-being of an individual, and not merely the absence of disease or infirmity. So, my dear, how is your spiritual life? How is your spiritual life? How do you interact with God? How is your relationship with God? Then mentally, are you okay? There are some behaviors someone will be exhibiting. You'll be like, are you sure this person is okay mentally? Psychologically, how is this person behaving? Some people are sick mentally, but they don't know. Some people are suffering psychosis, but they don't know. I'm telling you the gospel truth. Some people are having psychosis, serious mental disorder, but they don't know. My dear, you need help. You need help, honestly. You need help. If your spiritual life is not in order, if your physical life is not in order, if your social life is not in order, if your physical health is not in order, my dear, you're not healthy. Being healthy is not only about physical well-being. No, you have to touch everything that I mentioned. Okay, you have to touch everything. You have to be healthy physically. You have to be healthy socially. You have to be healthy mentally. Okay, there are ways you respond to things. There are ways you respond to things, to matters. Okay, it's not everything you now give an outburst. There's a way you handle situations. So if all those areas I've mentioned now, you're not okay, you're not healthy enough in those aspects, my dear, try to. Okay, try to. Now, please, for those that are joining us right now, I said something earlier about infertility, that it has come to our notice in the society today that the men leave everything in the head of the woman for her to bear alone when it comes to infertility issues. Please, I'm talking to you right now, you watching me here right now. I want to give you this word, okay? I want to give you this word. Let it inspire you. Let it just be the thing you hold on to. Even though you're getting treatment from the family, from your husband, from the society, please don't take it to heart. It is only God that can save you. It is only God that can help you in that situation. Run to God, hacking on Him. Okay, hacking onto Him. He will be the one to help you in that situation. We give drugs, yes, we treat, but it's God that heals. You come to us, you see so many people coming to us, you have this, you have that. Yes, we treat them, but we are just pencil in the hand of the Creator. We are just pencils in the hand of the Creator. It's God that oversees all. He'll be the one to give you that permanent healing you're seeking for. Everything is in His hands. If you're facing challenges, if you're facing problems, if you're facing humiliation, maybe from your mother-in-law, from the society, please hearken on to God. Talk to Him. Even if you're giving you medications, in the morning before taking them, please pray. Pray to God. At night also, talk to God. You tell God, God, please see. As I'm taking this treatment with EJ1 Fertility, God, please, I'm begging you, let me get my results. Let me get my healing from this uh from this place I'm going to. Father, let it not be in vain. Let me not waste my money. Let it not be in vain. God, please, hearken to my voice. Hearken to my voice, please. Okay, someone is asking what is really major problems causing infertility. Yes, I'm just seeing it now. Someone is asking, what are the major problems? Amos Peter, I'm just seeing your message now. You said, what is really the major problems causing infertility? Okay, when you come to infertility, we have primary infertility and we have secondary infertility. So there are things that can cause this primary or secondary infertility. First and foremost, the major causes of this infertility, that's why we as we ring it as a bell. Even when you're living your youthful when you're living your youthful life, please be mindful of the things you do. As I'm answering Amos Peter's question right now, if you have any question, you can drop it on the comment section. We will surely answer you. Yes. So the causes of infertility, that's why we ring it as a bell. As a young woman, as a man, when you're living your youthful life, be mindful of the things you do. Be mindful of the kind of life you live. It's very, very important. It's very, very pertinent. You might not be facing any problem as at that time, but it is when you are now, when you want that thing, that's when you'll be seeing that, I've really messed up my life. Oh God, please, I've really messed up my life. Okay? Some people, we the youths, there are some things we take. Do you know that contraceptives has a way of blocking a woman's tubes? All these contraceptives you take to prevent pregnancy, when you too much intake of it, can make a woman, can block your tubes. I'm telling you the gospel truth. Too much contraceptives. You might be taking them, you must have been taking them then, no, and you were okay, nothing was happening. But now, you're in your marriage now, you want to conceive, but nothing is happening. Nothing is happening. You're crying to God, God, please, what is the problem? Contraceptives can cause a whole lot of damages to your body system. As a woman, it can block your tubes. It can do so many other things that we don't know. I see a whole lot of girls, they take contraceptive. Some people go on to take contraceptive like 2 times a month, 3 times. What do you expect? Do you know that all those things are hormonal drugs? They are hormonal drugs. They can even end up scattering your hormones. You wouldn't even know. For a woman to conceive, your hormones should be in order. But if you end up taking all those things that scatters your hormone, a whole lot of women are suffering hormonal imbalance today. A whole lot of women are suffering hormonal imbalance today. And you might be asking yourself, why am I suffering this hormonal imbalance? What's the cause? You don't know, it must have been the things you were doing when you were young, the drugs you were taking, the activities you were engaging yourself in. Why will you be taking contraceptives 2 or 3 times in a month? Why? Why? The, in fact, some people now use it as their daily drug. They take it if even how what do you expect? Someone that has not even given birth to a child, that is still in her younger age, is now putting all these injectable contraceptives. Why? Why will you be doing that? You're causing problem for yourself tomorrow. So, my dear Amos Peter, the things we involve in ourselves in, like the habits we involve in ourselves in during our youthful age, mainly is the causes of all these infertility issues women are facing in marriages today. I'm talking about the women. I'm also coming to the men. That's the causes of all this infertility today. Please mind the way you live your life. Too much of everything is bad. Please. Too much of everything is bad. Another causes of infertility today is as a result of prolonged infection, prolonged untreated infection. That's why we ring it as a bell. We ring it as a bell every year, at least every year. At the beginning of every year, as a lady, go for tests. Go for tests to know how your body system is, to know if you have any infection, so that you treat that infection. So that you treat that infection. You know that infection are being caused by microorganisms. Microorganisms are foreign bodies that enters into your body system, and when it enters into your body system, it destroys some things. Even as a woman, when you contact an infection and it travels, maybe you're having a discharge from your vagina, okay? It's the pH of that it scatters both the pH of that your vagina. It scatters everything. Okay, so that's why once in a while, from time to time, as a young lady, go for routine checkups, go for infection tests, and you will now go and do a urine culture test, and they tell you that you have a particular infection. My dear, do well to treat it as soon as possible. Clear it away from your system. It is not if you go for tests, they tell you that you have Candida albicans. Then you now go to a chemist shop. Ma, please, I just went for a test. They told me I have Candida albicans. Please mix drugs for me. Let me take. You now take it for 3 days. You say, I'm okay. That's not it though. You've not treated yourself. That infection can end up coming back, or it stays in your body. It will now go and carry its brothers and sisters and now relax very well. Then when it will now come to pepper you, they will now come in quantum. That's why once in a while, go for infection tests. Treat it, flush it away from your system. Pata, make e no dey again. Pata. Because there's what you call PID. PID is the leading cause of infertility today also. But people don't know. What is PID? Pelvic inflammatory diseases. What are the causes of this PID, or what triggers this PID? PID is just the accumulation of too many infections in your body system. Just imagine someone is carrying more than 2 or 3 infections in his or her system. Oh God, what do you think? What do you expect will happen? As a woman, you're carrying Candida albicans, you're carrying Staphylococcus aureus, you're carrying yeast infection, you're carrying chlamydia in one body. Do you want to kill yourself? How do you think your reproductive organs, how do you think they'll be reacting? You know that infection is a foreign body. And you know that we have red blood cells, we have white blood cells. White blood cells are the cells that helps us to fight infection. So when this cells is present in your body and infection comes in, they will detect that there's a foreign body in your system. The infections now will now overpower that your white blood cells. You see yourself. That's where you now come and be seeing symptoms. You now be experiencing the symptoms of those infections. So my dear mothers and sisters in the house, please do well to go for infection tests once in a while, so that you flush away infections from your system. Okay, it's very, very pertinent. Okay, so that you flush it away from your system entirely. So you don't end up having PID. I've seen someone that she has been married. She has been married, but the only problem she's having is that she has PID, and that PID has made her not to conceive for years now. The only thing is that she needs to tackle that PID, treat it. How can you be carrying more than one or two infections in your body system? It will scatter your body now. It will even scatter your hormones. It will even scatter your reproductive organs. Everything will just be scattered. So if for you to treat that infection, you need to treat it and also balance the person's hormones. Okay? Because once infection enters into your body system, your immune system, it breaks down your immune system. Your immune system drastically reduces, it drastically pulls it down. It drastically pulls it down. So that's one of the major causes of infertility today, PID. Okay. Then from the men too, we should also be mindful of how we live our life during our youthful age. Because if you come to us, you're facing infertility, we'd send you to a whole lot of tests. As a man, you go for sperm analysis test. You also go for urine culture test to know, let us know if you are harboring any infection in your system, especially staph. You see that staph infection, it is capable of stopping a man or a woman from getting pregnant. It's even capable of eating up a man's sperm cells. Staphylococcus aureus. That infection, fear it. Fear it. And how can you fear it? Going for checkups and know that you have it. You treat it. Look for possible ways, whether herbal, whether English medicine, whatsoever. You treat it and you go back for tests and it's confirmed that you don't have that infection again in your system. Because it has a way of eating up a man's sperm cells. It even has the capability of making a man have quick ejaculation. Yes, it causes so many things. It causes low sexual drive in the man and the woman too. So it's very, very pertinent you check all these things earlier enough. Then another causes of infertility again that people don't know, people don't really know. Please, as you're joining us, please like, comment, and share this post. Please like, comment, and share this live so that you get your data giveaway or recharge card giveaway immediately after this live. Please do well to comment, like, and share this live for you to get your data giveaway. So as I was saying, another main causes of infertility again. You know that when a couple wants to get married, it's advised that they go for a series of tests to make sure that they are okay. What are those tests? The genotype, the blood group, HIV and S. Then there is also another test people forget to do. What is that test? Jesus factor. Jesus factor. Honestly, our society itself is not even aware of this. So many people don't even know what is Jesus factor compatibility. As a couple, it's very pertinent enough for you to check your Jesus factor compatibility before the both of you get married. As a man and a woman, your Jesus factor should match. If it doesn't match, my dear, you will find it difficult to get pregnant. Or even if you get pregnant, you'll be having miscarriages. I tell you, I'm telling you this from experience. You'll be having so many miscarriages. That baby cannot stay. That baby cannot stay. And even if you manage to get pregnant and carry that baby, injections should be given to you. Series of injections should be given to you either when you're pregnant or after the delivery of that baby, to enable you get pregnant again. Because if that injection is not given to you, you cannot be able to get pregnant again. Okay, you cannot be able to carry your baby again. That's why it's very, very important. Jesus factor compatibility. That's another cause of infertility in our society today. Okay, please do well to check. As I'm talking to you right now, as you're listening to me, I don't know if you're as a couple, I don't know if your own matches with your husband's own. But if it doesn't match, please please, you can go now to check in a hospital. Just go back. Maybe you've been finding it difficult to get pregnant, or your baby, you do miscarry your baby. You can do well to go and check in a hospital. Tell them that you want to check. That if people want to check your health factor compatibility, they will check you, know if your own matches with your husband. Okay? Then if it matches, then you know you're on the right side. But if it doesn't matches, you know that that's now that's now a problem. Okay, now know that's a problem. So that's one of the causes of infertility again. Then I'm coming to the things, coming to infertility as a woman. When you are suffering or you're having infertility, you have to, there are some series of questions you should ask yourself. What is really causing this infertility? Is it as a result of infection? Is it as a result of my organs not functioning, my reproductive organs not functioning well as it should? Or what exactly is the problem? That's why you need to see a doctor. If you see a doctor, you explain everything to the doctor. The doctor now knows what to do. Either is to send you to a text in order to confirm what the problem is. Then after confirming what the problem is, the thing again is to tackle the problem, to tackle what is the problem, the causative agent of that thing, whether it's infection, to tackle it, whether it's as a result of anything, to tackle it so that you get yourself. Some people come to our DM, ma, please, oh, I want to get pregnant in 2 months. So you want to get pregnant in 2 months, but you have problems that you've not tackled. How is that possible? So many people come to our DMs, they'll be like, ma, please, I want to get pregnant. I want to get pregnant in 3 months. How is that possible, my dear? Where you've not tackled the little problems that you should tackle. You're having infection you've not treated, yet you want to get pregnant in 3 months. You're having fibroid that you've not treated, that you've not flushed out of your system, but you want to get pregnant in 3 months. How is that possible? We are not magic now. We are not doing magic, my sister, now. We are not magicians, okay? We are not magicians. We don't do magic here. We are not that herbal clinics that you will go, or all those people that will dupe people and tell you, my dear, you must surely get pregnant though. Don't worry, in 1 month self. No. We don't do magic. And we don't scam people. We don't do scam here. We tell you the actual thing you need to know. We don't do scam here. We tell you how it is. Even though you don't want to hear it like that, we tell you what it is. You need to tackle the problems first before going to conception. If you come to us, we tell you, okay, look at your problem. You have infection, or you have staph infection, or you need to tackle this staph before going to conception therapy. You need to tackle the problem first before going to conception, because our treatments are in segments. We treat you the infection first. If you have fibroid or ovarian cyst, we tackle the fibroid first. We tackle the ovarian cyst first. We tackle the endometriosis first before taking you to conception therapy. We now know that we've tackled all your whole problems. Maybe you're having hormonal imbalance. We first of all tackle those problems. We first of all balance your hormones. Some people, their progesterone is too high. Some people, their estrogen is too low. We first of all tackle all those problems first before taking you to conception therapy. Then we know that what we are giving you now is conception medication that involves you coming for massages. Yes, we do massage also, because massage helps in conception. Yes, it helps in conception. It also helps to reduce stress. It also helps to clear blocked tubes. I'm going to list the importance of massage to you right now. It decreases stress and increases what? Relaxation. Hormonal imbalance. If you're facing hormonal imbalance, massage can help you balance your hormones. Yes, it can help you. Regular massages. Then also, you might be asking, how will regular massage balance my hormone? Now listen to this. A regular massage will improve blood flow to the organs and deliver hormones present in the blood to its destinations. You get me? A regular massage will improve blood flow to your organs and deliver hormones present in the blood to its destination, to the place is being needed. That's an importance of massage. Now, also, it helps to clear blocked tubes. My dear, if you're having blocked tubes, if you've gone for HSG test and they told you that you're having blocked tubes, massage will help you to unblock your tubes. And as well as you're taking medications, it will also help you to unblock your tubes. Then also there are people that has undergone series of surgeries. They've ended up, it has made them to now suffer what we have called scar tissues. They are now having scar tissues. My dear, massages also can help you. Massages also can help you to clear those scar tissues. Okay, these are the importance of massage. Then another importance of massage, also massage therapy, is that it aims to reposition your internal abdominal organs. You can believe with me that for people that are coming for massage in our clinic, we focus mainly on your abdomen. We do the massage on your abdomen. I'm talking about fertility massage, your conception massage. You know, we have overall body massage. That's not what I'm talking about. I'm talking about fertility massage. For the abdominal massage, we focus on your abdomen. Why are we doing that? We are doing that to reposition your internal abdominal region organs, your internal abdominal region organs, which includes your uterus. Okay, if they are not in good position, it helps to reposition them. Also, it helps the blood flow to those regions. Okay, some people, the blood flow within those regions are poor. So massage also helps to increase the blood flow within those regions, so that it will increase the chances for fertilization and implantation of a fetus into your abdomen. Okay, it helps to reposition your internal abdominal organs like your uterus, okay, so that it now optimizes it for the chances of fertilization and implantation of your uterus, of your fetus, sorry. So that's the importance of massage. And we cannot, some people come, please, do you people do massage? Yes. Can I start now? No, you cannot start because you've not entered conception. You've not even tackled your problem and you want to go into massage. Unless you don't have any lying problem. Unless you don't have any lying problem, like you don't have an infection, you don't have fibroid. It's just that you have been finding it difficult to conceive. Your tubes are open, you don't have blocked tubes. That's when we can now go ahead with the massage and start giving you massage. Okay? But if you have underlying problems, if you have some problems, we need to tackle those problems first before going into massage. Okay? Then also for the men too, if you are a guy, if you are a man and you are now finding it difficult to impregnate your wife, or you're having some sperm issues or whatever, it's good you go for sperm analysis test. Then from the sperm analysis test, you'll be able to know if your sperm cells are in good conditions, because we have different problems as regards to sperm cells. Someone can be having oligospermia, someone can be having azoospermia, many things as regards to sperm problems. So you know that you are the one doing the work, not the woman. You are the one to impregnate the lady. So if your sperm cells are not in the right position they should be, and mind you, a man's sperm cells should be at least 20 million sperm cells in order to pregnant a woman. So please, I don't know if you have any question, you can drop it under this live so that we can tackle it or answer your questions. And also, uh, please uh, do well to like, comment and share this post so that you will get data giveaway. Abi you get too much data wey you no need our data. If you need data now, begin to like and share this post, please. Begin to like and share this post, please. Ah, please, in conclusion, please, In conclusion, please, our dear mothers, our dear husbands in the house, please do well to treat your wives good. Okay, don't maltreat them, abeg. Do well to treat them well. Do well to treat them right. Don't say because your wife hasn't conceived, you now be giving ill treatments to her. Remember, you took her to the altar. You told her for better for worse. Abi, you don't forget wetin pastor tell una for altar. Ma remind am for you now. Say as una dey altar, pastor say for better for worse. You can't repeat am say yes na for better for worse. So I don't know why you go dey treat your wife badly. So do well to treat your wives badly. This cross is for the two of you people. It's not meant for anybody. Two of you are carrying the cross. And with God helping us,